Hello and welcome to another update on COVID-19, this time recorded on the 19th of July 2020. Topics for this one will be about a reminder of some of the transmission issues regarding COVID, a bit more of an insight into the Victorian numbers that have been going up and up recently, about the new mandatory mask rule that's just coming in early this week, and then a question about the discussion about elimination versus suppression of COVID-19 and what approach we take for this. So starting off just with a reminder about some of the transmission issues, just to make sure that this is absolutely clear, because there seems to be that there's still a lot of people not absolutely certain about some of these things. So just when you do get exposed to COVID, the typical time between the day you get exposed and the first day you would get symptoms is generally 5 or 6 days. Now, there is a range for that. Some people, it can be as short as 2 days, and others, it can be as long as 14 days. And when you are going to develop those symptoms on whatever day it is, typically the first time your swab would become positive is generally 2, maybe occasionally up to 4 days before those symptoms start. So that means if you're someone who doesn't develop any symptoms till day 10, then your swab would definitely not be positive until somewhere between day 8 or maybe as early as day 6. But if you get a swab on day 3 or 4 and it's negative, that does not mean that you're not going to get it. It just means that it's too early to test for it. So that means that if you have had a clear-cut exposure to this and you've been asked to go into quarantine for 14 days, even if you get a swab done early on, that doesn't mean, and it's negative, that doesn't mean you can come out of quarantine. You still have to stay in quarantine for the full 14 days. And if we're doing quarantine absolutely to the rule, what we would try and do is do a swab test on day 11 or 12. And then if you get to day 14 with no symptoms and get a swab done on day 11 or 12 with that being negative, then we can be pretty confident that you don't have it. And also that hopefully we've picked up those occasional cases of people who get it who get no symptoms at all. So moving on now to the Victorian numbers, and no doubt, like me, probably many of you are looking at those numbers each lunchtime and with a degree of anxiety as you approach that time when the numbers come out. And certainly it's been very worrying over recent weeks as the numbers go up and up. And you can probably guess from the graph you can see here that it's not likely that we've hit the peak yet. In fact, most of us are predicting the numbers are still going to go up quite a lot, even though we have these lockdowns in place now and this new rule about mandatory mask use. So why are these numbers likely to continue rising? So there's obviously some transmission that we can control by getting people to stay home and to do all the social distancing and so forth. But it's also important to remember that when you start a new rule, whether it's a lockdown or a new mask use, then you've got to remember that that won't have an effect for a while. So when you see the numbers for today, essentially you're looking at the transmissions that occurred roughly a week ago because of that period of being exposed and then taking typically 5 or 6 days to develop the symptoms and then go and get tested and then take a day or two to get your results. So when you see the numbers for today, that's effectively the transmissions that occurred at least a week ago. And so even though we've got these lockdowns in place and we're about to start having these mandatory mask rules, we're seeing that a lot of the people that are getting it at the moment are ones that are going to keep spreading it even with the current restrictions in place. So we're seeing a lot of cases in people who come from large households, so people with many people within the same house. And so the chance of keeping it from each other in a very small house with a lot of people is very difficult. Also, we're seeing cases rising in some aged care facilities like nursing homes. And again, it's an area where it's very hard to control those without having further spread to other people within them. We're also seeing some cases in prisons and in asylum seeker detention centres. And so these are places where it's very likely to spread even with all the community restrictions in place. So unfortunately, even with everything we're doing, we're still likely to see numbers go up and probably go up quite a bit further than they are at the moment. And it will take probably at least a couple more weeks before we start to see any plateauing of that graph. And then maybe after that, hopefully start to see them come down more effectively as a result of all the things we're doing. And on top of that, at least up until today, there's still plenty of people out and about shopping and in shopping centres. And so those transmissions in those places are still going to continue even with the restrictions that we're seeing. So you've probably heard there's now this new rule in Victoria that masks are going to be mandatory as of a couple of days from now. So Wednesday night this week, the 22nd of July. So the reason why we're doing this is there's been some modelling done recently where if we can get everyone who's going outside of their own home to start using masks, and then particularly because most of the transmissions occur indoors, we're having everyone using masks indoors and essentially making it essential to have the masks on to get to that place. If we can get 90% of people using masks, then that improves our chance of getting control over the current situation. within about 6 weeks from well below 10% to about 50%. So 6 weeks is probably not going to be enough to get things completely under control. But if we do things well, then hopefully we can be on our way within 6 weeks and not take too much longer than that to get the numbers down. But just remember, though, that masks have to be used correctly. And so just a reminder about the correct use of masks. So first of all, wash your hands before you're putting the mask on. So either soap and water or some alcohol-based hand rub. Then just remember that the mask has two sides. So there's the darker blue side and the lighter blue side. And so the dark blue side is the side that goes on the outside. It's got the wire at the top, which you can bend and keep in place. And then when you're putting it on, you should only touch the loops. You should only touch these bits, the wire loop, sorry, the loops that go over your ears. That's the only part that you should touch. You shouldn't be touching this blue part at all. And then when you put it on over your ears, then you press it over your nose and the tops of your cheeks to make the wire fit into place and seal that part of it. Then while you're holding onto the bit at the top of your nose, then pull the softer strip of white down the bottom under your chin. And you should really be avoiding touching the blue mask area at all times. But if you are going to, just make sure you're washing your hands with something like alcohol-based hand rub both before and after doing so. And always clean your hands before you take the mask off as well. And these masks do have a bit of durability, so that, for example, with nursing staff working in the COVID wards who are using these, then for an 8-hour shift, they would use 2 masks in that time. So they get about 4 hours use out of each mask. So you can potentially, if you're being careful about not touching the blue part, you can potentially reuse it if it's just you using it for up to 4 hours of use. So just a quick bit about this question about should we be aiming for elimination or suppression in Australia? So at the moment, it's a bit of a semantic issue because really, particularly with the situation in Victoria, and we're seeing also numbers starting to creep up perhaps in New South Wales too, essentially what we need at this stage is just to get back under control. And so what we really need to aim for, whether we call it one or the other, I think what we have to aim for is to stop local transmission. And after that, we need to make sure we're getting quarantine right in future so that we don't have the same situation where people coming back from overseas and then with inadequate quarantine process that then we restart chains of transmission like we've seen recently. So obviously this is a very contagious condition. It was only about 7 or 8 months ago that we only had 1 case in the world, and now we've got many, many millions. And so even if we get things down to very low numbers, that's not going to be enough. So really, we have to stop all local transmission and then be really careful about any reintroduction from people coming from overseas in future until we have either an effective vaccine or an effective, early, cheap, available treatment. But our best bet is to aim to be like countries that have stopped local transmission, like New Zealand or Taiwan, because that's been not only a huge benefit for them for their health reasons and for being able to go back to a relative degree of normality there, but it's also been much better for them economically than any of the countries that have not achieved control of local transmission like that. So if we can achieve complete control like this, which effectively is elimination, then that's when we're going to have the economic benefits of that as well as all the health benefits. So really, we need to get this down to 0. And finally, this lockdown situation is really hard on everyone. It's hard on parents, it's hard on people who run businesses, it's hard on everyone in the community. It's really difficult. It's particularly hard on patients in hospital now who can't have any visitors. And it's also particularly hard on people who are waiting on elective procedures who are not getting those done now because of all the healthcare facilities being taken up so busily with COVID work. But if we all do the right thing, if we can comply with these the rules of lockdown, if we can do the staying at home, the social distancing, the mask use and the hand hygiene, if we can do all these things really well, the more we do it and the more people that do it, then the sooner we can get back to something like normal and easing those restrictions. Conversely, if we do this half-heartedly, then we're going to be stuck in this situation of these restrictions for a lot longer. So let's do it right, and let's get down to 0 cases of local transmission so that we can then achieve something closer to normal once again. And once again, thank you again to the amazing workers throughout the hospital system who are doing such a fantastic job of looking after all the people with this condition, who are taking the risks of doing this care, risks to themselves, risks to their families, but still providing such an amazing level of care. And it's very pleasing to see that Australia's had one of the lowest death rates from COVID admissions in the world. So we're really proud of that, and we hopefully can continue that. And as long as we keep cases down, then we can do a lot better job of doing that. So thanks again, and till next time, goodbye.